Good evening. On behalf of the City of London, welcome to one of the first Our Core Area forums. My name is Kelly Sher. I'm the Deputy City Manager of Environment and Infrastructure, and I'm also the current Chair of the Core Area Steering Committee, which is a group of senior staff at the City of London who are charged with overseeing the implementation of the Core Area Action Plan. We wanted to start hosting these forums in order to connect interested people in the community with the City and London Police Service staff who lead major work in the core area. Presenting today are Jim Chula, our new Manager of Core Area and Urban Regeneration, Kevin Dickens, our new Deputy City Manager of Social and Health Development, Inspector Dwayne Price from the London Police Service, and Sergeant Mark McGugan from the Coast Program. And I think I messed up your titles this morning. Sorry about that, gentlemen. They're going to be providing some information to you after a bit of general information from me, and then we'll be answering some questions using the chat function in this virtual meeting. All right, so we can talk a little bit about our agenda today. And Patty, if we can just get the next slide. So I'm going to provide you a bit of a general update on some activities that have been going on with the Core Area Action Plan and other city-led initiatives. Jim Chula is going to speak to you a bit about the Ambassador Program. Kevin Dickens is going to talk a bit about some of the summer social service and social supports. Inspector Price will speak about the Downtown Foot Patrol. Sergeant McGugan will talk about the new Coast Program, and then we'll wrap up and take some of your questions through a moderated chat. So in terms of, I want to start us off with a bit of an update on the Core Area Action Plan. As many people on the call may know, the Core Area Action Plan was approved by City Council near the end of 2019, and funding was approved in the multi-year budget process that was concluded in early 2020. Of course, just as work began in earnest on the Core Area Action Plan, COVID-19 struck and really changed how we were doing everything as a community and as individuals, and certainly as a city. What we've noticed since the start of the COVID-19 pandemic is that there have been disproportionate impacts on urban core areas. This is a true experience across Canada, throughout North America, and around the world. The large number of office workers who are currently working remotely has created a distinct reduction in the level of activity in core employment areas, those things we see at lunch and coffee breaks and right after work. Reduced tourism and recreation opportunities, things like conventions, sporting events, concerts, live theater, festivals, have all had real social and financial impacts on core areas, and as have the pandemic restrictions on business operations. We also recognize that vulnerable and marginalized communities have faced disproportionate impacts during the pandemic as well. Many service providers in this sphere have suspended or reduced their operations during COVID. Despite the impacts of COVID, staff have continued to work on delivering the Core Area Action Plan. Funding was approved by City Council to provide for 65 of the 71 actions, and 3 other actions were advancing in full or in part through other programs. The graph you're seeing right now shows where we were in July 2020, 14% complete, 77% on target, and 9% reporting as caution. Versus now where 34% are complete, 63% are on target, and 3% are reporting as caution. We have made progress, but we know the situation in the core needs our continued focus and attention as a corporation and with our community partners. And we need to work together with businesses, residents, interested agencies, and within the organization of the City of London on both immediate and long-term solutions. I want to highlight a few other efforts before we turn things over to some very specific discussions that the city has been doing in order to respond to concerns in the core. In January, Council endorsed 20 actions identified by the London Community Recovery Network. Another 12 actions were already underway in existing budgets, and the new actions represent over $1.8 million in additional spending. Of that 32 action total package, or idea total package, 15 of those ideas are directly related to the delivery of services to strengthen the core. The rest actually are citywide based, but also apply in the core areas. So there's a lot of opportunity for us to make improvements through that program. We've also established a back to business team and portal, which brings together staff from many areas within the city in order to expedite requests related to the pandemic. We're seeing a lot of requests for things like temporary loading zones, sidewalk sales, and patios, and we'd like to use this as the basis for reducing red tape and providing easier access to getting approvals for those sorts of things in the future as well. It's been part of our commitment to engage better with the BIAs and communicate more effectively. So we've created 2 new engagement opportunities: the core area strategy team, which includes the executive directors of the 2 core BIAs, as well as 3 deputy city managers, and we're collaborating on strategic issues and opportunities. On a more tactical basis, the core area action team includes staff from City Hall as well as from London Police Service and the BIAs, and they're meeting weekly in order to address short-term issues quickly and collaboratively. We just had a meeting this afternoon, in fact. Several enhanced communication strategies are also now in place, including a comprehensive core landing page on the city's website, a new Get Involved site to help focus our participation on core issues, and a new monthly newsletter. We're also working on changes to the Service London portal to make it easier to find who you need to get help, as well as some really neat highlights around social media about activities that are happening in the core and the people who are making them happen. And finally, we've made some changes to our internal structure. One thing we heard loud and clear through our own consultation and through the work of the LCRN folks working on the community recovery was a desire for there to be a clear core business unit at City Hall. So this makes the perfect time for me to introduce Jim Yanchula, who is the new manager of core area and urban regeneration. Jim's a familiar face to many people in the core, so he's a good fit for doing this exact kind of work, and we're part of the planning and economic development service area. Jim, all yours.
Good afternoon, everybody. I'm here to talk to you with a little bit more detail about the upcoming Ambassador Program. The Ambassador Program will be focused in the boundaries that comprise the core area that were outlined in the adopted core area action plan. There's a kind of illustration there for you to see that it extends up Richmond Street to Oxford, sort of along the CN tracks on the south, the river on the west, and almost all the way east as far as, well, past Egerton to Woodlawn. The boundaries, though, you know, I will call them nominal because it's not like we wouldn't step across the red line if there was something happening on the other side of the street or something, but it does give us some focus to where you will expect to see our core area ambassadors. Next slide, please. Core Area Ambassadors program, coming right out of the Core Area Action Plan, specifically recommendation 25, is a pilot program that has been approved in principle, as Kelly mentioned, through the multi-year budget process. Unfortunately, we couldn't get out of the gate as quickly as we wanted to after that approval because of COVID. But beginning in November, we did a very deep dive into program research and development and just kind of finished it up last month so that we could have a tailored to fit gradual introduction London solution to our take on what core area ambassadors can do at all at the beginning and grow into. The proposal that we have will go to the Strategic Planning Priorities Committee of Council next week. And then pending council approval, we are all set to launch for July 2021. The launch will include a lot of back of house work that we have to do in hiring up, outfitting these people, making sure they have proper training. So we'll be really, really busy. In fact, you know, we're kind of already really, really busy in getting that going. Next slide. Thank you. The purpose of the Core Area Ambassador Pilot Program is an enrichment purpose. It's to enrich the core area experience for residents, businesses, and visitors. It isn't to duplicate anything that is already being done. It is only to supplement what is already being done. So you'll hear from others of my colleagues this evening who have other aspects of attention to the core. This one is a complement to that. The specific objectives, I think, are worth pointing out bullet by bullet. To foster a welcoming and safe environment. So friendly faces on the street, people who have knowledgeability about the area and are able to offer help even when not requested, but to go up and offer a friendly hello. That, we believe, will help the second bullet with contributing to a vibrant core area that everybody feels is their destination to feel welcome in. And then, as I said, it provides support to current programs. It doesn't take their place. In our core area ambassadors program, we went and we looked at all kinds of municipalities in North America. Here's just a couple of examples of what core area ambassadors can look like in other places where they've already been introduced. That deep dive in informing ourselves about what the parameters and possibilities and pitfalls of the program can be were based on us conducting interviews with 20 different City of London staff in different areas, partners in the community. We had 5 or 6 of those. Then we went into best practice communities that we thought had been doing programs for a long time in similar circumstances with similar budgets. We interviewed 6 of those best practice communities. And after we did all those interviews, we had a survey that went out to 15 of the interviewees for even deeper knowledge on how they ran their programs and what we could learn from those programs. Next slide, please. And what we found was the best model for us is to have the program run by the City of London. So this will allow us to make good connections with all of those other service areas and community partners that I just mentioned earlier in my remarks, and helps us relate it to what other activities even other city departments and service areas are doing. We have determined that this will be a year-round position. We'll have full and part-time employees occupying them, and summer situations, also some additional temporary positions. And it'll all be based on kind of where the areas of most intense activity are, where people feel an extra pair of people walking around the streets would be helpful. And that would be in conversation with all of our service partners. We will take the cue that others have and make sure that we put them in branded uniforms so that they are easily identifiable. As you saw in the earlier slide, people will know when they're looking at a core area ambassador. Our operational window is from as early as 7 in the morning till as late as 11 p.m., but it'll vary how many would be on staff at what times during the day, depending on intensity, depending on weather and so forth. And then finally, as I alluded to earlier, this is new for London. So we are going to have to staff up and make sure that when we do so, we offer the people who will be out there comprehensive training and onboarding in cooperation with our service partners and the business improvement areas, and then sustain that on an ongoing basis so that we can constantly modify to suit the needs that are presented out there. One of the things that is going to be important in the comprehensive training is to know, for these ambassadors to know what all those other service areas that have already been provided in the core area do, so that they know when they are supplementing and not to overlap or muscle in on somebody else's territory. If you think of an ambassador as a friendly face in situations like a large train station or an airport or an amusement park, where people kind of are looking around and they may be a little baffled and they may need somebody to come up to them who can offer them information and a sense of direction. So I would say if somebody's standing in front of a parking meter or looking at a parking sign and saying, now, when do I pay here? Or where do I pay for parking here? Or do I even have to pay for parking here? Instead of waiting to figure that out, when an ambassador walks by, they should be cued to look at people on the streets and sidewalks and say, I wonder if they need help. And then it could be something as directions to a place that somebody from out of town doesn't know. So they've arrived at Victoria Park and they have no clue where the convention center is. Our ambassadors might be able to help them with that and so forth. These are just minor examples of many, many activities. Next. So when I say many, many activities, I do not intend to read this chart ahead of you. They are the proposed year one activities. And we've got them kind of in 7 different categories on the left-hand column there about the kinds of supports that they will do, and then some specific examples about how they would be manifested as time goes on. So these in year one, we're not presuming that every single one of these bullets and every single one of these categories will be executed every single time every ambassador's on the street. But it does give a good touchstone about what's kind of within mandate and what's beyond mandate for their activity. And then, because it's a pilot, we will take stock and we will adjust. Next. So in conclusion, the core area ambassadors efforts are a supplemental thing and an enhancement thing. It's not taking away anything that's already been allocated to address our challenges and opportunities in the core. It's one more piece of the puzzle. An important part of that will be, how does that puzzle piece fit with all of the others that are already operating? So we in the ambassadors program will make a strong effort to get good pilot program metrics, make sure we know where the areas of greatest need are, where the areas of greatest activity are, both geographically and service oriented and so forth, so that we'll understand the value of the program at the conclusion. At the end of our presentations, we'll be available to answer questions. Thank you.
Thanks, Jim. And I'll pick it up from here. So my name is Kevin Dickens. I'm the Deputy City Manager of Social and Health Development. I want to touch on a few things with you today, recognizing first, really some of the societal issues or social issues that we're seeing show up on your doorsteps. And we know that those are presenting all kinds of challenges for the business community and our core area partners, but also walk through for you some of the many initiatives that we have on the go and some that will be coming forward over the summer months. We continue as city staff to work across all service areas in what we call an enterprise-wide approach to supporting and addressing a lot of these systemic issues that are challenging our city. And I think when it comes to some of these challenges, we know that it leaves us a feeling that we're not doing enough. And we know, we hear it, frankly, that, you know, we should really do more, the city should do more. And we don't disagree, and we're certainly trying. But I think I'm going to walk us through just some of the challenges that we're facing as a community, just to provide context. So some of the challenges that are facing our sector, we've experienced in London locally, but also province-wide. Members of my team and myself were very involved in provincial tables and a lot of strategy discussions. And we're seeing across the province an increase in street-involved activity. That can include people milling about, hanging around, but it also includes a growing number of individuals experiencing homelessness and people experiencing unsheltered homelessness. And there is a bit of a difference. We have what I think, and it's a biased opinion, is one of the best tools that any city in Ontario has at their disposal, and that's a coordinated access program. Our coordinated access program acts as a front door, single point of entry for anyone experiencing homelessness, so that we can do some rapid triage, assessment, divert. We're diverting, I believe it's 45% of people away from emergency shelters, getting them connected to other housing supports. However, our coordinated access team throughout the pandemic since March 2020 has started to receive a growing number of calls from people experiencing homelessness for the very first time. And that's an alarming trend for us as a community. A lot of young professionals and individuals whose labor has been disrupted by the pandemic So we're keeping an eye on that for sure, but we're also seeing growing numbers of people sleeping unsheltered. What is also impeding this situation or causing some strain to it is our booming home sale market. And while we like to celebrate it for very good reasons, the home sale market that has gone through the roof has actually created downward pressure on the rental markets, as probably everybody on this call knows. When you combine that with a flatlining or a stagnant income earning threshold for London, and then you add in the impacts of a pandemic, the affordable housing market in this community is almost non-existent. In fact, we just took a report to council committee on Tuesday night where we identified a number of statistical trends in our community. But one of them that really stood out is that for every 1,000 individuals that are earning $36,000 or less every year, there's fewer than 30 affordable housing units available to them that they can afford to rent. And what that does is it creates a large portion of our population that are in a very deep housing affordability crisis. Some of the other challenges that we're facing as a community, and I think we're all facing this one together, is that provincially and certainly locally here in London, we're seeing higher rates of release from correctional institutions to the local streets and to unsheltered homelessness. This has raised red flags for our human services sector, and we've had plenty of conversations with various ministries. But we're seeing this play out where an individual might be released from a correctional institution somewhere else in Ontario, but if they have ties to London or they're originally from London, they're often sent back to their home community with really nothing more than a couple of masks and maybe some money to get them there. Elgin Middlesex Detention Center, as we know, they are, when they release somebody, through our partnership with the Middlesex London Health Unit, those individuals make their way to our city-funded COVID isolation and monitoring spaces for a number of reasons. One, either the individual is being released and they're in fact COVID positive. We have seen this play out multiple times. Or they're coming from EMDC, where it's a bit of a COVID hotspot and they may be considered a close contact. So individuals will come to our monitoring space where they will stay until they receive a COVID test and they get that result back. If they're test negative, they move on their way. And if they're positive, they move into our isolation space. Although we have a crown jewel in the coordinated access system, and although we work very closely with our partners, there still seems to be very little, if any, coordination with city services and how to best align and wrap around services with this population. We know, and this has tragically played out in the public eye, that our community is experiencing an uptick in lethal opioid use on the streets. And I might just pause for a moment to acknowledge, the efforts of the business community and of individual employees who have gone above and beyond and gone out of their way to support people that they find sleeping unsheltered, who might be in a level of addiction crisis, and even going as far as administering naloxone and CPR. And I don't think we could ever ask more of our business community than that. And it's very admirable. We know that whenever there's a death in our community, there is a notification process amongst the vulnerable population. Those deaths do not sit lightly with our team. It has a significant and profound impact on our staff, as it does with you. And we are really trying our best to work with the experts in that field to come up with solutions of how do we combat this crisis that's playing out on our street. A recent media article profiled that there's more than a dozen ways that fentanyl is being designed or cut and mixed. A string of these recent overdoses has impacted people both housed and unsheltered. And often we like to draw a line and say, well, Someone's passed away from an overdose on the streets. They must be homeless. We're not doing enough. And in some cases, it's a harsh reality where we're seeing a lot of folks that we've housed or who are housed with supports are still finding their way back to the streets. Either that's where their social connections are, that's where their peers might be, or there's activity that's drawing them there. And we know that the fentanyl does not discriminate, whether you're housed or whether you're unsheltered, whether you're low income or whether you're wealthy. It has impacted our community in many ways, including individuals, Black, Indigenous, and people of color. We know that access to the necessary addiction services and or crisis supports, it remains a Ministry of Health priority, but we run into some challenges at the local level with the Ontario Health teams, the Ontario Health West team, where it doesn't necessarily crack their 2021 top priorities. So I get nowhere as a municipal employee pointing fingers, saying that this health crisis is a provincial responsibility and it's not my job. And in fact, our team takes a very opposite approach to that. We continue to actively engage and try to bring various ministries at the provincial level into these conversations. We have a local municipal council that has been very open and active in their advocacy around accessing provincial Ministry of Health dollars to support the needs of our community. And we'll continue to push those buttons and pull on those levers. Some of the additional challenges we're seeing is that our 24/7 outreach workers are encountering couples and individuals with pets that are currently unable to access the traditional shelter system. This is something that through our temporary winter response, we found was so critical. Having low barrier spaces for couples to access and stay together. It is one of the most common points of refusal for someone accessing services or supports is if they can't stay together. Individuals with pets would much rather sleep on the street with their pet than to give up that pet to an animal shelter or humane society to care for so that they can move into some type of emergency accommodations. We're also seeing individuals who have complex health concerns, bilateral amputees, comorbidity issues, individuals with deep-rooted and historical trauma, and trauma so significant that they have a profound distrust of those that are providing help and those that are trying to provide care. And in many cases, rightfully so. People often turn to substances and drugs to cope with their trauma, to dull the pain of the trauma. But that trauma is so profound, it takes years to work through. And we know that the distrust of the system is because they've reached out before and it did not end well for them. So our outreach workers through London Cares, which is part of our coordinated informed response team, work tirelessly just to build relationships, seeing the same person every day to try and build those relationships to break down some of those barriers. We're also seeing a lot of folks on the streets, again, as part of our 24/7 outreach, that are really struggling with underserved mental health needs. Put all of this together, you have a large population that has been unsuccessful in the traditional shelter system, or in some cases, they've been outright banned because of an inability to manage their behavior, or some of their actions are just not safe for the other people who are seeking supports. Recent attempts, and we see this, we hear this complaint from the business community. You know, I opened my business at 6 a.m. and there's a person sleeping in my doorway. How come outreach hasn't done anything? I called, no one's doing anything. Well, what's happening between midnight and 6 a.m. is that our outreach workers are encountering and engaging with these folks every single night, 7 days a week, often with food in hand, with an offer to an overnight resting space. And we're still getting a lot of individuals that just simply refuse the help and refuse the service. Some of the individuals we've encountered of late come with some very complex medical concerns that, if we're successful getting them into hospital for care, often results in discharges to the street same day. In fact, we've had members of our team on the phone with health professionals, with a nurse's station, almost to the point of pleading that they keep somebody overnight so that we can have some time to get some resources in place so that they're not discharged on a rainy Tuesday night to homelessness. This is going to be a challenge that we will meet head on for quite some time. But that's enough about the challenges. We really need to focus our attention on what has been happening to support you. So as I mentioned, throughout the winter months, there was the creation of a temporary low barrier overnight shelter. It was accompanied by day space programming to help those on the streets that have been unsuccessful elsewhere get into safe accommodation with supports. Those 24/7 supports, provision of meals, basic needs, clothing. It actually led to some individuals being interested in having conversations about finding their own place to live, exploring employment opportunities, reconnecting with other social supports. Additionally, we've also increased the capacity of the 24/7 Coordinated Informed Response Program. For those who are unfamiliar with the CIR program, this is a program that involves outside organizations from the city, as well as internal resources. That includes the London Police Services, our City of London bylaw teams, our roads department, parks staff, and of course our homeless prevention team. We also work with our community partner, the London Cares program, where they provide the outreach support. Additional measures that have been taken as well is the rapid expansion of a 10-unit head lease pilot program. A point of pride here is that London is the first community in Ontario to launch such an endeavor. The 10-unit pilot quickly expanded to 25 units by the end of this month. Opportunity was there and a need was there, and we were able to move quickly on that. We have increased shelter capacity through the use of hotels across the city to ensure proper physical distancing. As you likely know, congregate living settings were particularly hit hard during COVID, and the need to provide physical distancing and safe accommodation required that the city enter into some agreements to provide that space in partnership with our shelters through a hotel system. We've also been providing 24/7 staffing supports at hotels, not only for the physical distancing, but as I mentioned, for our COVID monitoring and isolation spaces. Increasing funding to our supportive housing programs has been something we will continue to work on. It's been something we've been able to implement, though, where we shift some of our resources away from the traditional supports to really put our investments where they make some of the best returns. We know that getting somebody a roof over their head, handing them a set of keys starts the solution, but it does not equal the entire solution. And housing with supports is so critical. So we've been able to really shift the way we think and the way we fund the system and the way we align resources to capitalize on more supportive housing programs. And as of today, even, we're still working to launch and increase the number of resting space beds in the community beyond what our existing capacity is. Our staff team is currently working on a report back to Municipal Council, which will outline our plans to support the vulnerable population, but more specifically support those that were involved in our temporary winter response and what we plan to do throughout the summer months. We've seen great success. We've seen lots of challenges. We've have lots of lessons learned from the winter response, but we plan to report back in June to Council with what we will do as next steps to support those individuals. We are actively working on additional transitional housing options for those that are sleeping unsheltered. We continue to work with our BIAs on the formation of advocacy efforts to the provincial government, really focusing on highlighting the need for a multi-ministerial response to the needs of the City of London. And that includes, the work we're doing as city staff and building upon it, where we perform direct advocacy to ministries like the Ministry of Municipal Affairs and Housing, the Ministry of Health, the Solicitor General, and the like, because we know that if we want to make an impact in our community, it's going to take all of us. We're also participating in direct advocacy with the federal government, as well as the provincial government, on our Indigenous homelessness strategy, our mental health and addiction system locally, and our rapid housing initiatives to try and bring more dollars to the City of London so we could advance those affordable housing projects. And in closing, I will just finish again with an acknowledgement that the experience that some of these social issues have had on the business community, I mean, it's quite literally showing up on your doorstep now. And I can't imagine what it would be like when you add in the impacts of COVID and how that has taken a toll on the economic realities of small and medium business owners. But we know that as city staff, we owe you a debt of gratitude for the work that you're going through and the work that you've been providing, the supports, the compassion, the empathy. You know, I touched on the story of people providing CPR to those unsheltered, offering meals out of your stores, sandwiches, clothes, that sort of thing. It truly is humbling and it means a lot. And we thank you as the core area partners for the work that you do to support those that are vulnerable. So thank you for your time.
Hello, everyone. I'm Dwayne Price. I'm an inspector in the uniform division. I'm in charge of patrol operations. So pretty much any officer that's out on the road responding to calls for service reports up to me. And I also am in charge of our foot patrol unit. I'm just going to kind of give a little bit of an update on our downtown foot patrol project that we've been running since February. This project was in response to the increasing numbers of commercial break and enters and other property related crimes that had been happening in the downtown and Old East Village. The report is just meant to provide a current progress on the crime reduction trends and outcomes and the measurables as well that have been achieved. The stats are a reflection of two projects that were designed to work in unison in order to try to achieve our objective. The first project, we asked our officers to focus on hot spots where selected crime types were prevalent. The premise behind this approach was to deter crime by acting as guardians for business owners who had been negatively impacted by the increase in crime in those hotspot areas. It's been running since February 5th. We had a second part of the project, and that was called Blockade. Now that one was geared towards targeting prolific offenders. We call them the power few, which are individuals that are responsible for a majority of the commercial break and enter occurrences and other property related offenses in the downtown and Old East. During that project, Blockade, officers sought out and engaged these individuals on a routine basis to encourage them to desist their criminal lifestyle. And for those who responded positively to offers of help, and there was actually more people than we expected, did respond positively and did take the help that was offered. And then for those that did not accept the police help, well, then the officers focused on deterring them from further crime. The cumulative effect of both projects operating in tandem has cultivated success in the overall crime reduction. Now, I'm going to say this right off the hop here, that the crime rates have gone down since the start of the project. And you'll see as I go, we're kind of at pre-pandemic levels right now. But by no means is this the police patting themselves on the back. This is just trying to show that at least the trend is going down. We know there's so much more work to do. We are out there every day, dealing with many of the same things that you are. And so this is not a success story. That's not what we're trying to say. I just want to provide the information and at least say that we are, through these strategies, we are seeing a decline. In terms of crime trends, this section of the report will concentrate on crime trends for the project period from February 5th to April 11th. I don't have the most recent numbers because that report's not due out for a few days. I do know that it has continued to go down a little bit. So some of the major findings that we've had is comparing the project period this year to the same time period last year. There's been a 23% decrease in commercial break-and enters. And again, comparing the project period this year to the same period last year, there's been a 38% decrease in thefts from motor vehicles. And overall, as of April 11th, property crime offenses have been the lowest weekly incident rate observed in all of 2020 and 2021. Since the advent of COVID-19 pandemic, a multitude of variables may be responsible for crime patterns emerging in various parts of the City of London, including the downtown core and Old East Village. And for this reason, it is important not only to compare our current crime trends to the previous year under the pandemic circumstances, but also pre-pandemic circumstances to achieve a better understanding about what's transpiring. It's been very difficult for us just when it comes to, it is for everybody when we're trying to look at data related to 2020 because it's all over the place because of lockdowns and everything else. So if we do look at 2019, 20, and 21, basically the weekly average in 2019 was 38 occurrences involving what we consider kind of the big three property offenses, which is thefts from motor vehicles, commercial break-and enters, and mischief or property damage. So 2019, 38, 2020, it was up to 43 on average. And then so far, 2021, we're back down to 38. I would like to see the numbers go down to maybe 2015 numbers would be great, but at least we're trending back towards the 2019, getting away from that spike in 2020. Our project outputs, aside from the reduction in crime rate for our designated crime types, several other outputs were measured during the projects. This section of the report I'll be going through. We measured several factors. That includes arrests, hours spent on the project, our CEPTED evaluations, which is our crime prevention through environmental design. Those evaluations, which I'll speak more about a little bit later, mental health occurrences, and then other social services that we've offered to individuals that we encountered in the downtown and Old East Village. So, what we found because of the hotspots and putting officers in these hotspots where it's data-driven information, right? So we engage our crime analysis unit, we engage our modernization, patrol modernization unit as well. And they collect the data based on the crime trends that are happening at the time. And we're able to take some predictive measures and put officers strategically in certain locations where we believe crime is most likely to happen or has recently happened. The research shows that, if an address is targeted for a break and enter, normally within 24 to 48 hours, somewhere else within that same block is targeted too. So we would make sure that we have officers in those areas ready. And what we found several times during the project is officers were able to respond to break-and enters that were in progress and make arrests while the suspects were still either inside the business or in the motor vehicle that they had broken into. And that's as a direct result of hotspot policing, because the officers are saturating those areas where criminals have targeted the most. So you can see there with the hotspot, and know that these hotspots change, right? Like, it's not a matter of the beginning of the project, here's your hotspot, and you just go out and you hit those areas, you know, for the next several months. It changes, and it's normally weekly that, you know, a hotspot, we could see it maybe change. But daily, our officers receive updates about what had happened the night before. Where are the areas that they should concentrate on? And, you know, I'm just providing kind of a broad view of the hotspots here. What the officers get is not only this, but a very specific, like right down to this parking lot, this building, and not just this block. And I can say that, you know, looking at this this map, it's you know, that's not what the hotspots looked like when we started the project. So we watched them kind of move, and then we tried to put our resources in the areas where we have the best chance of preventing crime, not just responding to it. Of course, we can't be everywhere all the time. That we don't have the resources for that. But going about it in this fashion gives us kind of the best bang for our buck and most opportunity for us to prevent some crimes before they happen. Sorry about the just charges and arrests. So the numbers as of April 11th, they've gone up since then. We've arrested but didn't charge 5 individuals. Something like that, you know, obviously that doesn't happen very often. Arrested and charges laid, 80 individuals. No arrests but charges laid, 9 individuals. And then with the amount of time spent on the project, our uniformed division patrol sections and community foot patrol officers, because this is in tandem, it is a foot patrol project and a foot patrol led project, but we have uniformed patrol officers that normally work other sectors of the city. We've had to take resources from those areas to also staff this project. So community foot patrol units and uniformed division patrol officers have spent 5,782 hours on this project. 3,746 of those hours were just foot patrol. And I throw those numbers out, and I know they're meaningless to you. That doesn't mean much. But what I can do, what I can tell you is, when I compare, right now we have the crime gun task force is going on in response to the shootings we've had in the city recently, and the numerous handguns we've taken off the street during 2020. And I can speak on that issue. I did work in guns and drugs for 10 years. I also worked in foot patrol back in the early 2000s, which was the joy of my career. But in guns and drugs, we chased around guns all the time. And the amount of guns we're taking off the street right now is not like it's significant. So with the crime gun task force, I've put less officers from patrol towards that project than I have towards this one. So there's more officers being put into this situation than there is in the crime gun task force. And yet you see on TV every day, the task force is kicking in doors, seizing guns. You know, the level of success that they're having immediately, and these tangible results that you see, it kind of shows, you know, just how complex the situation is downtown. It requires more people. It's going to take longer to see the crime trends or rates drop compared to these more traditional criminal issues that we're dealing with on the gun side. But I just think it's important to point out that it is a significant amount of resources that have been pulled from other areas of the city to try to tackle this problem, because we do recognize that this is it's a significant issue, and we're doing what needs to be done. It's continuing to go. We're still going. The chief had told me when we started this that the project is going to be up and running, and there is no end date. So normally we have a hard line. We're going to do this for 3 months and then we'll assess. That's not where we're at right now. So know that this project is continuing. The one portion of it in blockade, that part has ended, but we got something else we're going to ramp up now. And with blockade, the targeting of the prolific offenders, that was about property offenders. What we're going to do with the next round is we're going to do a similar thing where we identify prolific offenders, but it's not going to be so much about property offenders. It's going to be about those individuals that are just causing social disorder in the downtown and Old East. You know, the ones that are coming into the businesses and causing a scene, throwing things around, being aggressive, but maybe not committing a criminal offense, but terrorizing business owners and their customers. So that's going to be the next focus for us. And I think that, if we go about it the same way we did blockade, I think that we'll be successful with that as well. So part of our efforts to prevent crime, our community police officers, so not part of our foot patrol. Again, this is now pulling in people from other sections. We leverage the CEPTED strategies to target hardened businesses most susceptible to victimization. CEPTED was offered unconditionally to all our community partners and businesses in the downtown core and Old East Village. CEPTED's a multidisciplinary approach to crime prevention, which manipulates the urban and architectural designs found in the natural environment to help reduce victimization, basically target hardening for your business or the area. During the project period so far, community police officers have conducted 45 CEPTED evaluations, all free of charge for those business owners who took up the offer. Also, officers attended all victimized locations proactively and solicited owners to accept free CEPTED recommendations to prevent future victimization. In terms of mental health and citizen engagement, while police officers from community foot patrol sections were proactively policing the downtown core and Old East, they were also asked to engage vulnerable citizens exclusively for the purpose of providing much needed supports. London Police Service reached out to our community partners to aid in this assistance. These interactions were positive in nature and not designed to over-police an already vulnerable community. And during these interactions, shelter, beds, food, clothing, and other essential services were offered. We kept stats on these interactions. And so during the project period, we had 606 interactions with 248 unique individuals. 212 times the individual declined any assistance. 40 times service from our community partners were unavailable, and 32 times services were accepted and provided. Know that we're not tracking the times that our community partners weren't or were unavailable as to point out some sort of deficiency. It's just also that our community partners are overwhelmed too. We're calling for service and they might already be helping somebody, down the road. And so, but it was important to show how many times it is that we do try and we can't because of that they're busy as well. Mental health concerns continue to be a problem in the downtown and Old East. During the course of this project, there were 154 mental health occurrences of various types that our officers have responded to. And with the mental health calls, right, like they're not quick calls. So a lot of times that will take our officers kind of out of the play for a little while. There is some great supports that we have as well that have kind of lessened the load for us. And then we've also developed some new strategies with our coast team, which you'll hear about next, that will also be able to help moving forward. So finally, again, I just want to say, you know, we understand what you're going through here, and our response is going to be nimble and moving and based on the evidence that we're getting and the stats that we're getting. I do ask that you continue to report crimes. I understand that it can be a little bit frustrating if you're calling in a property damage and that gets triaged by our comms center as being of a lower priority, and sometimes you're waiting for hours. But please know as well, we've expanded our online reporting for the non-emergent calls. And if you go on londonpolice.ca, like it's pretty easy to navigate and now through the website. But it's so important for us to get that information. Your car is broken into, damage to your property, because that's what drives how we respond. That's what helps us with the hot spots. That's what shows us what's going on. So I ask that you please consider that if you're making a decision whether you think it's worth it to call or not. It is. That's all I have. Thank you. I look forward to when we can all meet in person.
Thanks, Dwayne. Good evening, everyone. I want to thank the committee here for the opportunity to speak to you today and present on our new Coast unit. I think we're pretty excited about the team. We rolled out about a month ago, start of April. I'm Mark McGugan. I'm the Sergeant in charge of the Community Crisis Response Unit here with the London Police, and I oversee the new Coast team. Coast stands for Community Outreach and Support Team. What we are is a community-led, police-supported initiative dealing with mental health, directly with the mental health. It's the London Police Service partnered with the Canadian Mental Health, CMHA of Elgin Middlesex, St. Joe's Healthcare here in London, and the Middlesex London Paramedic Services. Each team consists of a pairing. It's a Coast Constable with one of our clinician partners. And part of that too is to ensure the safety. So when we do go into an environment, be it downtown, be it a residence apartment, we have the safety because the officer is there with his use of force or her use of force, as well as our community partner, the clinician. So we have a pretty good approach to the mental health when we can make sure it's safe and then add an assessment right on scene there. And maybe the goal is to take our client to the facility or the treatment center that they need to go to best serve whatever ailment they're dealing with at that time. Our role is to ensure the safety, as it says here, and assist in providing support, guidance, and counseling. Assist the directions to the persons who have experienced or are experiencing mental health. As we know, there's multiple levels of what mental health is and how it affects people. Our unit is very small, but we're just starting out. So we deal with all the mental health calls that we can within the city. If we just jump to the next page there, please. The team consists of a London Police Service sergeant, the team supervisor, that's me. We have 3 full-time police constables assigned to the unit. 1 member from the St. Joe's, 1 member from CMHA, and 1 member from the Middlesex London Paramedic Services. As I said earlier, the London Police Constable is teamed up with one of our community partners, so they form a 2-person team. We call it a middle management team, where we go out and manage a situation and then hopefully direct, again, the client to wherever they need to go to. One of the initiatives we took forward is plain clothes. So we're all wearing plain clothes, a uniform. As I said, the officer is still carrying their service pistol. But we want to lower the stigma when we deal with somebody. So we attended an unmarked vehicle. And we come in plain clothes, so it lowers the stigma to the client at the other end. So it's not a police response, if you will. So we're gaining a lot of trust with the people that we're dealing with. We have 3 teams, and I think we've got here the schedule up. With the 3 teams, we tried to cover off as much as we could, but as you can understand, we just can't cover every hour of every day. What we looked at was the amount of times we can best serve the amount of calls that we have. So when we went through When do we deal with mental health? We know it happens 24/7, but for the most part, these were our peak times that we can deal with it. So Saturday, Sunday, we have one day shift team on, which again, one team consists of 2 people, an officer and a clinician. Monday, Tuesday, Wednesday, Thursday, we have an afternoon shift. That gives us a chance to deal with the nighttime homeless people, the nighttime interaction with London Cares or other businesses that we deal with. And then Wednesday, Thursday, Friday, 2 units are in. It gives us time to really impact if we have an area that a hotspot, as Inspector Price talked about a bit earlier. If we have a hotspot that we really like to attend and deal with there, like this week we put together a project that Wednesdays for the next 3 weeks, we are attending downtown to speak to all the homeless people downtown, provide them with contact for our services and direction if they wish to go to shelters or what it be. But if you just flip the next one, please. What are we doing? We're here to engage in regular routine interaction with individuals living in our community with serious mental health issues who are in frequent crisis and who are at risk of crisis. So if you look at it, we're talking about serious mental health crisis. I mean, that goes up the scale, but someone could one time be in serious mental health crisis. They may not have a history of it. They may just come up in one time, and especially we've seen it during COVID, one time, and they're into a serious crisis right away. We will deal with them, and we'll also deal with the people that are in constant serious crises. The homeless, people that can't find a shelter to go to, or downtown. We see it downtown quite a bit, where they're acting out, going into some of your businesses, and just acting wild, throwing things around. That's when we could come and maybe offer some assistance or support, be it addiction services, shelter, food, whatever it need be. We want to assist individuals in managing their life changes by assisting these individuals with the system navigation. And basically what that means is we want to make sure they get to the resource that they need to get to. Sometimes they're not even aware that it's available. For veterans, for instance, we do have a veterans helpline that we can get people to. There's lots of areas that we can reach out to people that, again, they're not aware of, and we can direct them there, and we can also drive them there if need be in certain circumstances. So we want to support our community healthcare partners in helping individuals living with mental illness within their specific treatment and care plans. So a lot of Form 47s out there, so people are missing their shots for whatever reason. We will deal with that as well, so we can apprehend, and that's one of the advantages of having a police officer assigned to the teams is the police officer can apprehend under the Mental Health Act. And then if we have to take somebody into custody and take them down to the facility. So we do have that ability. And that's one of the advantages of having the police officer in the team, as well as the care plans and providing early, and this is important, early and proactive crisis intervention to hopefully alleviate it down the road as we move forward. So we want to provide safety and security for the community, including the individuals being supported, our healthcare community partners, and the community at large. The support, our London Police Service first responders engaged in mental health crisis and high-risk calls for service. A lot of times, if somebody's engaged off their medication, whatever it be, when they see an officer show up, the uniformed cruiser showing up, it actually elevates their risk. So hopefully with us attending in plain clothes, in a plain vehicle, it lowers the stigma and allows us to deal with them without elevating, already heightened state that they're in. We will take uniform officers with us, and they'll hang back a bit until we know it's safe to move forward. Again, apprehensions when necessary, and we want to prevent unnecessary apprehensions by providing alternate solutions. We deal with a lot of people that they don't need to be apprehended and they don't need to go down to the hospital. So in the meantime, we can assess them because we have a clinician right with us who we can make an assessment on scene and then take them to the facility that they need to go to without apprehending them. Maybe it's just a shelter for the night, or maybe it's just to go get them their medication, which they couldn't get before. We want to improve the experience that the individual has, even if they are apprehended. So if the uniform officers apprehend somebody in the street, they take them down to hospital. If the coast team's available, they will go down and relieve the officers. So that way we can sit with them in the hospital there and make that transition a little easier. We've been working with London Health Science Center as well to make that transition as smooth and seamless as possible. So, and we're not a replacement for the mobile response team as well. We are going to be dealing with a lot of our community partners, London Cares, anybody like that. We're going to deal with as many as we possibly can, work hand in hand, because the idea is to get the clients off the street and into the area where they can get the help that they need. So pending any questions, that's my presentation for the night. So thanks again for allowing us to attend here.
Thank you so much. I appreciate everybody spending some time with us tonight, and we will be doing some questions and answers very, very shortly. I just want to extend some thanks to all of our panelists who are here today. We also have a number of other staff who are behind the scenes who've been helping us organize and who can help with more specific and detailed questions. The pandemic has exacerbated existing concerns and created additional challenges for our community. These challenges have been focused very much on marginalized and vulnerable people and on businesses, and the two intersect. We know that navigating changing COVID restrictions, the lack of downtown office activity, and the lack of events in the core have combined with some of the impacts on vulnerable people and restrictions to services to create a particularly difficult environment. These issues remain an enterprise-wide concern and priority for the City of London, for our partners, and I know for London Police Service. This work will continue to inform our programs and policies, not only in the core, but in other areas of the city that are also seeing similar challenges to varying degrees. A report discussing the topics we've discussed tonight will be at the city's Strategic Priorities and Policy Committee on Tuesday, May 18th at 4 p.m. And you're welcome to watch that live on the city's YouTube feed. The team would also the team who's been involved in these efforts are here this evening and would be pleased to answer any questions you may have. So I'd now like to introduce Patty McKay, who's our Director of Strategic Communications and Government Relations, and who's been keeping us all organized this morning and this evening through our forums. And she's going to walk us through how the Q&A is going to work tonight. Thank you.
Good evening, and thank you, Kelly. And I'm very happy to be here to participate in this. For those of you who haven't used this platform before, we'll accept questions through the Q&A function. So you'll see a little icon with Q&A underneath it. And if you type your question in, we can then direct them to the person who's the most appropriate to ask them. So we do have some questions in the queue, so I'll get started right away. Our first question is related to housing. So when people are housed through the programs, do they tend to stay there, or do they tend to leave and return to the street soon after? So I'm going to turn that to our Director of Housing Stability Services, Craig Cooper, to provide an answer to that.
Thanks, Patty, and thanks for the question. Our housing support programs generally do provide housing stability for individuals. We do see from time to time individuals disengage with services or not be successful in the housing that they've chosen to live in, and do sometime return to streets or services. But for the most part, I would suggest that the housing programs that we have started recently are seeing a good rate of maintaining housing for folks and allowing them to maintain housing stability.
Great, thank you, Craig. We have another question related to housing, this time around advocacy. So Kevin, if you're able to jump on for this one. The question is asking, can you speak more about the advocacy to be formed in collaboration with the BIAs, and how is the city expecting the BIAs to contribute or participate in the advocacy?
Certainly. So around the advocacy efforts, this really is born out of a conversation we only had just recently with the respective BIAs to discuss the notion of creating something like a white paper. And I have to give credit to Jen Pistorius for this idea of exploring if other municipalities have tried this, if they've been successful. But really what it is it's an acknowledgement that the business community and the human services sector could partner together really to create a unified voice when it comes to creating a statement around the challenges that we're both facing, that our respective worlds are trying to address. And I think that unification of voice carries a lot of weight, certainly with upper levels of government, but also to highlight that we're not at opposing ends of these issues. We're actually at the same side of these issues, and we're trying to work on them together. So that's really where we're starting to explore this, is identifying the issues in sort of a white paper strategy, bringing forward some ideas and solutions, but entering into that joint advocacy, because the BIAs, they hold a lot of influence, and they provide a perspective that's different than the social services sector.
Thank you, Kevin. We also had a question submitted around the cleanliness of the downtown and what's being done to ensure the cleanliness. So Kelly, I'll turn that one over to you, maybe to provide an overview of what's happening just to keep the streets physically clean.
Sure, absolutely. Through the 2020 to 2023 budget process, Council did provide us additional money for cleaning under the Core Area Action Plan. Last year, unfortunately, with COVID, we were unable to hire our temporary staff. So the only thing that really got funded was some additional solid waste collection and our new pressure washing program, which is contracted. So that started later in the summer. We are able to hire our temps this year. We have those, the pandemic safety measures in place. It's not full service citywide, but it will be full service in the core. So we're really excited that this will be our baseline year to spend all the funding that was provided to us by council and to really make a difference in terms of solid waste collection, litter collection, graffiti removal, pressure washing, sidewalk sweeping. So it's going to be a really good opportunity for us to establish what we can do with the funding that we're able to obtain.
Thank you, Kelly. We have a question that I think would be generally for anyone who is speaking or anyone who's providing services. The person is saying that they're grateful and thankful for the updates, but can we identify what strategies are being used that are different, that haven't been applied in the past? Or is it really about just getting better results? And in housing areas, the response to homelessness have improved, but affordable housing is not the answer. It's more geared to income housing. So it's kind of a two-part question. Kevin, maybe I'll turn it to you first around the housing piece of it, but maybe then either Dwayne or Mark would like to speak to the difference in the strategies that we've applied from their perspective as well.
Thank you, Patty, and thank you for the question. The housing topic is a complicated one. You know, it really comes down to conversations around depth of affordability. I think where we get caught up sometimes is that we look at affordability in comparison to other communities. So London is very affordable. Actually, there was a media article about how London is the second most affordable community next to Windsor in relative comparison. But what we see based on local demographics is that we have a lot of work to do on the affordable housing front. So it really comes down to the depth of affordability. When you look at the average market rent of a one-bedroom apartment being close to $1,200 a year or a month, that's not really affordable for a large population or large group of the population. So we need to look at that 60% of average market rent, 70% of average market rent. The rent geared to income housing serves a purpose. And in fact, we're seeing a lot of work happening through London Middlesex Community Housing with their regeneration strategy and looking at how they can modernize some of their RGI units. But it's also not a model that's very sustainable when you look at life cycle renewal and the operating costs. So when we look at what council has set forward as a direction for us, which is to create 3,000 affordable units in 5 years, that's going to be a strategy that's going to cover and canvas the entire city, all corners of the city at all different depths of affordability. And one way we can also achieve access to more affordable housing is through our operating agreements. So when we can enter into an operating agreement with a provider for 25, 30 years, maybe 30 plus, then we can guarantee and maintain that depth of affordability for those individuals for a longer period of time. Hopefully that answers the question.
Thank you, Kevin. And was there anyone else who wanted to provide comment on whether the things that we're seeing have an impact in the core are either new strategies, or is it just about better results? Dwayne?
This is new strategies for us. Now we've had a modernization unit, and we've also had our crime analysis unit. But to kind of tackle more of a broad-based issues like we have downtown, we haven't We haven't gone to them for this type of issue. This is the way of the future for us. I believe that this is how our foot patrol units will be deployed moving forward, whether there's a project involved or not. Instead of just going out and randomly patrolling or where you think the hot spots are, or, you hear from some citizens and you might go to one area or the other, but to actually have some of that data that is driving where they go. This is new for us. The pandemic has kind of forced us into it to get things moving a little bit quicker. This has been our strategy all along, but now we've just started to do it maybe a little quicker than we had thought, and we're liking what we're seeing so far. But this is a new strategy for us here in London. We're not creating anything here. Evidence-based policing has been around for a long time, but in order to get some of the tech involved and up and running, and then get the bodies in place, and then with the proper training, both of our officers in our modernization unit, one has just got her master's from Cambridge in evidence-based policing. The sergeant in there is currently enrolled at Cambridge in evidence-based policing. So this is new strategies for us.
Thank you, Dwayne. We have a question next about Project Clean Slate and whether someone could provide a little bit more information about the proposed pilot project. I think we have Orest or George on that may be able to speak to that.
We seem to be missing Orest right now. I'm not sure if he disconnected or if he's still around. So I can start to, and maybe Kevin can provide a bit of support as well. I think we must have lost him. Technology is not always our friend. So Project Clean Slate is modeled after a successful program that has run in a number of cities, mostly throughout the US. And what it does is provides grants to the business improvement areas to hire people with lived experience of homelessness to help support private property owners with the cleanup of loose garbage, debris, and trash. And we would provide supports for those folks with respect to training and hiring and those sorts of things. And Kevin can probably elaborate a bit on that. And I'm hoping Orest might have reconnected in the meantime, or that George is able to chime in as well.
Thanks, Kelly. I think you've provided a lot of overview there that's kind of paints the picture of what we're trying to accomplish. Really, it is something that would be brand new to the City of London. It would be a partnership with the respective BIAs. I think our team in my area of social and health development can offer linkages to employment organizations, and we can also provide support for direct training in this process. What we're looking to do is provide opportunity for people with lived experience, so recent experience of homelessness, individuals who may have been participants in our winter response, or maybe they're currently staying in shelter, or maybe they're part of those groups that has recently been housed that Craig was talking about that are looking for continued stability. So it's an opportunity to create some employment mechanisms, and hopefully it's a successful pilot.
Thank you, Kevin. I'm actually going to hold you up for another question, if that's okay. Really a question around the temporary winter emergency shelter, and really just looking at long-term plans for safety and security of that area. Just given any further developments with that.
Certainly, and I really appreciate the question. What we endeavored to do as part of the winter response was really treat it like an emergency response, create a space where individuals who have not been successful in other places, or we would like to categorize as the hardest to serve, had a place to go. What we're seeing now at the end of the winter months is we've actually transitioned new people to the space, individuals who've made a lot of progress throughout the winter to reach a level of stability where we're working continuously on their housing goals and really on addressing their acute medical concerns, getting them wraparound support. So it's a bit of a different mix of population on that site, but the concerns are heard and well noted. At this time, what we have approval and direction from council is that we operate that space until the end of June. So at this time, we're continuing to provide that intervention and that support in more of a transitional housing framework until the end of June. Knowing that we've partnered with a community agency, that community agency is overseeing all of the daily operations on that site, including the 24/7 security as well.
Thank you, Kevin. The next question I'm going to ask is directed to Dwayne, and the question is about limitations for police regarding lessening drug use arrests and those who are arrested for a variety of actions that have negative impacts, and then the reality that quite often they're released back onto the street shortly after to wait for a much later court date. So Dwayne, if you could maybe just provide us some additional information about the limitations that you face in those situations.
Sure. And, you know, I didn't bring this up during the presentation because, you know, I don't want it to sound like, you know, the police are just complaining about how our hands are tied and that type of thing. You know, but the fact of the matter is that there are some things legislatively that have significantly changed how we do business. And one of those is Bill C-75, which is kind of a major shift in the provision of the criminal justice system. And there's amendments in there that promote the timely release of an accused person from the roadside with the least onerous conditions imposed. So prior to this, we would bring an arrested person into custody if certain criteria were met, but we'd bring that person into custody, and the decision to make the release would be done by a cell sergeant in consultation with the constable, and they would make a determination at this point. Do we believe this person is going to attend court? Do we believe there's going to be repetition of the offense? Is there some identity issues, that type of thing? But now we're in a position where it is basically, if it's considered like a less serious offense, we will release that person. That's the expectation, is that they'll get released at the roadside with either on some conditions, and again, the least onerous conditions. So, you know, putting boundaries on people like we used to do, there was, you know, and we did go overboard with some of the boundary conditions. You know, I'm talking 25 years ago when I started, that had changed over the years, but even boundary conditions now are not really acceptable. So to say, you know, you've damaged this store 5 times, you can't go in this area, that doesn't really fly anymore. Especially if there is services for that person in that area. And then we're also dealing with like, we're not involved in the decision making on whether the Crown's office proceeds with the charges that we lay. So if we do charge somebody with multiple offenses, if the Crown chooses to withdraw most of those charges or all of those charges, we simply get an email with a disposition saying, you know, charges withdrawn, or 9 charges withdrawn, 1 pled guilty, and that's it. So in terms of our authorities and what we can do, you know, it's we're in a bit of a tricky position. And then also, you know, for say a trespasser, so someone's trespassing, our authorities to do anything with that situation is minimal. If someone doesn't leave, we can arrest, but we can only arrest to remove them from that property, and then we give them a ticket. And that is a provincial offense. It is not a criminal offense. And you know, the penalty for not paying your tickets it's the same the same offense notice, just under different legislation, but as you would a speeding ticket. So if you don't pay that ticket, your license gets suspended. Well, if you don't have a license, that it doesn't really matter. So there's oftentimes that we're in a position where what we can do to actually help or remove somebody from that situation, there's not a whole lot. And we understand it's frustrating if you see us make these arrests and then you see the same person back in front of your business the next day. That's not a choice that we make. That is kind of the rules of how things go right now.
Thank you, Dwayne. We did have another question submitted, really just related to the vibrancy of the downtown and what kind of creative solutions have been explored. They referenced some of the things that have been done in the city of Kitchener, including adding some amenities to the park, like an outdoor workout space and some other playgrounds and children's areas. So I wonder if anyone could speak to that. Maybe Kelly?
I'm actually going to ask John Paul McGonigal to speak to a little bit of what's going on in Dundas Place. I unfortunately don't have anybody who's from the London Community Recovery Network internally here, but there's also a lot of really great ideas there related to vibrancy in the downtown, things like street markets and different types of festivals. I think a lot of it this year is going to be about scale. It's about what we can do safely in a pandemic, but I'm going to flip it over to Mr. McGonigal because he's going to talk a little bit about some specific ideas we're going to pilot on Dundas this year that could be part of something broader in the future.
Yeah, so thank you very much, and thank you for the question. As Kelly alluded to, we're currently working on an animation and activation plan for the core with all of our partners in the core who potentially have space or a role to play in that activation and animation. And Kelly talked a little bit about the Community Recovery Network, so I think it's important to hit on a couple of those items as council has funded some of the ideas that came through. So to give a couple of examples, they did fund the beginning of a Christmas holiday market in the core. They funded outdoor performances, and those performances could be musical, dance, theater, whatever that may be. So I think there's lots of opportunities coming in the future. We're actually excited sitting back and planning out the activation and animation. And I think the one thing we heard very loud and clear through the Community Recovery Network is when we come out of this pandemic, we're going to be ready to create that vibrancy and that atmosphere. And so we're really excited to work on that in the background, and we look forward to it. And more information will come out as the restrictions lift about what we can do and what we can't do. And we're excited about that. So thank you for that question.
Thanks, John Paul. We're actually coming up to almost the end of our time, and we do have one more question in the queue. So I will ask this, and then maybe we'll go to Kelly just for some final thoughts and some closing. This question is related to some of the services that are being provided to people who are living unsheltered and who require some additional supports. And it's really asking about whether there's anything being done to look at more remote sites for housing and temporary shelters so that it can ease some of the stress and pressures that it causes for residents in the downtown.
Thanks, Patty, and thank you for the question. It's certainly never our intention when we're doing planning to over inundate one community. I think really it is a delicate balance between where individuals prefer to be, where they're comfortable, where they used to reside, or where they're areas of the city they're familiar with also where services and organizations choose to be. I think you see organizations buy buildings, enter into partnerships, provide their services in locations where they know individuals need the support. But in terms of, where are we looking to go? What are we looking to do? I referenced the council direction of creating 3,000 affordable housing units in 5 years. That's going to take a citywide effort. That will be every backyard across the city to make that happen. But we do have Craig Cooper, on the call who might be able to speak a little bit to our Housing Stability Action Plan, which really sort of maps out what we're trying to achieve in this sector in terms of our services to the community.
Thanks, Kevin. And yeah, it's a good question and something we definitely grapple with every single day as we work with agencies to provide supports for people who are experiencing homelessness or at risk of homelessness. We do see needs all across the city, and as we work on implementing the various programs and responses in the Housing Stability Action Plan, we really focus on choice for individuals. And so the folks we support downtown, that we support in Old East Village, many want to stay in that community. They want to live eventually in that community. We support a number of people out in Westmount, Cherry Hill Mall area, Argyle Mall area. Every time we talk to them about getting into supports and looking at accessing shelter or something like that, they want to stay in their community. So I think as we look to work at implementing the Housing Stability Action Plan, that question will come up, and it has come up in some of the work we do now. We do have to take into account where people are needing to access service and where is the most appropriate area for services to go. And so as we transform the system with through that Housing Stability Action Plan, like I say, those questions will be paramount, and the feedback we receive from communities, people that use the service and providers of the service will be key in any decisions that we make.
Great. Well, thank you to both of you and to everyone who submitted questions, and to our panelists. I will turn it back to Kelly for some final thoughts and parting words. Good night.
Thank you so much, Patty, and thank you to you and your team for keeping us organized. We've learned a lot through COVID about how to engage using technology, and there's some definite benefits in terms of it's really easy for a lot of people to connect to us sometimes, but there's some definite cons in terms of not being able to see people face to face as well. Thank you very much to all of our presenters and our folks who are here behind the scenes to answer your questions. And absolutely thanks to everybody who spent their evening with us today, who signed in. This video will be available on our website. You will be asked a question actually as you exit this forum tonight about future topics you'd like to see us do in this format, or someday maybe in person soon. And I would encourage you, if you're interested in the outcomes of the discussion this evening, to follow the SPPC meeting next week on May 18th at 4 p.m., where the Committee of the Whole Council will be considering a lot of these issues. This is a really big priority for the City of London. I know that it is for London Police Service. We work closely with them, for your BIAs, and for our community partners. And we look forward to working with you together. And we look forward to hopefully a summer where we can be doing more of these things together in person in the core of our community. Thank you. Have a great night.